Hello and welcome. My name is John Darg and I am a Key Account and Clinical Affairs Manager for Dentsply Sirona, and it gives me great pleasure to introduce Simon Fieldhouse. Simon, it's an absolute pleasure to have you with us. Thank you so much for being part of Decoding Digital Dentistry.
Thank you, John.
I would like to just ask Simon to give a brief introduction to his background and experience on using CEREC. So Simon, if you wouldn't mind just saying a few words on your practice situation and your involvement with CEREC.
Of course, yes. Having given a presentation already this morning, you'll see that I've been using digital equipment for a number of years now. I'm a key opinion leader for Dentsply Sirona as well, and it will be safe to say that we do pretty much everything we can digitally in our practice. It's made a huge difference, which we're going to go on and talk about in a moment, and yeah, it makes for our working days to be very, very easy, straightforward, and lots of benefits, which I think we're going to talk about in a minute, aren't we?
Absolutely right. So the aim of this particular session is to give a commercial overview on the CEREC system. And as part of that, Simon, I'd like us to try and touch on three main points. Firstly, the business aspect of how CEREC affects the business. Secondly, the wider practice, so workflows and the team. And then finally, the patient and how it affects patient treatments. So if we can start at the beginning then, in terms of the business, it's fair to say that CEREC is a reasonably sized investment to make. Can I ask you to give some insight on the return on that investment?
Yeah, certainly one of the major conceptions and yet misconceptions is it's a really big investment. Yes, if you look at pound notes, it is, but I think the first mistake people make when they think, ooh, heck, that looks like a lot of money, is what they don't realise is they're actually spending that money on something else rather than spending it in addition to what they're already spending. So specifically, if you're looking at in-house milling, for example, yes, you purchase the equipment, but of course then your laboratory fees disappear pretty quickly. That's not to say that we don't use laboratories, because we absolutely do. And I would say the relationship with the laboratories is even better doing things digitally. But the investment itself is, whilst it's sizable, there are of course benefits to that. Your accountant will sort out the tax angle, that's always helpful. And it's surprising how quickly you recognise that that's not actually an issue at all.
Okay, so I mean, to clarify, it's more a case of redirected finances rather than new finances within the business.
Yeah, absolutely. Yeah, and as you say, redirected finances, but then when we come on to talk about the effect this equipment has, you'll see that those redirected finances have been spent very wisely. Okay,
and how does that manifest itself then in terms of return on investment? What sort of returns do you think that we're seeing with an investment into the CEREC world?
In our practice, as I said, when I say we do everything ourselves in-house, when you first start using this equipment, it's very exciting. We don't get out much, as you know, and you believe quickly that you can do anything, and you can do an awful lot if you have a CT scanner and you have a mill and you have a furnace. And in our practice, we've got 3 scanners, prime scans, we've got prime mills, we've got MCXLs, we have a CBCT, and we do a lot of in-house manufacturing for a few multiple crowns, some bridges, our implant crowns, and that's great because it gives us a lot more control. Not that we're control freaks in our profession, some would disagree with that statement, but it gives us a lot more control over what we're doing. And in terms of the return, which I know is what you're asking me about, very quickly you see that your actual costs in terms of unit costs for crowns, for example, are so much lower. I mean, if we were going to do a sort of lithium disilicate crown, to use the generic term, you might spend 150 to 200 pounds on a good laboratory fee, and the blocks, I mean, we can pick them up for, say, 15 to 20 pounds. Okay. So just in terms of unit costs, there's a big difference. And obviously that's then, you offset that against what you're paying for your equipment. In a practice that does just a reasonable amount of, say, crown and bridge work, never mind implant work, you start to see that your monthly outgoings are considerably lower and your profits go up. I mean, we've seen a year-on-year increase in profits over the last 5 or 6 years of 25% year-on-year. Now that's big. Not all due to digital, but a large proportion is. We audit these things. So it's surprising how quickly your profitability increases.
Wow, that's pretty substantial. And so to get some sort of clarity on those figures then, because you said it's not all attributable, but I'm keen to know, is some of that from efficiencies? Is some of that from additional workflows that digital sort of opens and gives opportunity for?
Yeah, it's in terms of unit cost we talked about, but efficiency, absolutely. It's a very different way of working. So whereas traditionally you might have a 2-visit appointment for a crown, we're doing crowns, bridges, things in a single visit, and so you have a more flexible diary. And in the space of 60 to 90 minutes, you may have produced 1 or 2 crowns for a patient. And because of the flexibility in your diary, and we're all really busy, post-pandemic, all of my friends and colleagues, we're all saying how crazy things are. We've never been so busy. And doing things digitally certainly helps with the flexibility, being able to squeeze extra things in. The girls at work will know that if I've got a 90-minute appointment, after about half an hour, I've probably done my prep, I've done my design, and I have sent that to the mill. And in our practice, we've trained our nurses to actually do the manufacturing process.
Well, it's funny you should say that, because my next question was going to be about the effect on the practice as a whole, about the team, about the workflows. And obviously, if you're doing design work as well, that sort of changes the time aspect of a workflow, doesn't it? So what would you say the effect of the practice overall has been, as I say, in things such as workflows, but also the team as well? Yeah. And I guess, is it possible to quantify any of those results in terms of profitability for the practice?
Yes. Certainly, as I say, our overall efficiency has massively increased. We don't, as I say, get out very much, so we do audit these things. So, as I was saying, once I've done the design process, the girls then take over the manufacturing. Yeah. So I can then go and check my emails, or possibly see another patient or drink a cup of tea, depending on how I'm feeling or what's in the diary. And they then actually will, once the crown or prosthesis has come out of the mill, they'll process it. So they will put the tints and the glazing on, they'll put it in the furnace, and they will finish it completely. So from my point of view, that's, as I say, I can do something else, and that's really, really useful, because nobody has enough time. But also from the staff point of view, they really enjoy doing it. The girls that do this, they've been well trained, and they make some really nice crowns and bridges. They look great, and because they're doing additional duties, we pay them more as well. So they quite like that.
I think that's a brilliant insight, to be honest, because I think for me, and probably the people watching, I think to know that it's not just about one person being the CAD/CAM expert in the practice, and that actually everybody in the practice becomes a CAD/CAM expert is probably invaluable, really.
Yeah, I mean, certainly the new patients now, depending on what they're coming in for, as you know, we do specialist work as well, but depending on what they're coming in for, most new patients will have a scan performed by the prime scan, and the girls are doing that now. So again, they enjoy doing that, and again, it means I'm free to do something else. Not necessarily anything industrious, but I am free to do something else, So again, it extends their role, it extends their duties, and they really enjoy it. I mean, if I say to them, "Do you fancy taking a silicon impression today?" They just look at me as though I've lost the plot, and we just don't use it, And then of course there are lots of, we probably won't even talk about the environmental benefits of doing things digitally, but they're huge.
Yeah, so I'm keen to pick up on just something that you said there about essentially the prime scan gets used for a scan for virtually every patient. Would it be fair to say that comes through? Mm-hmm. Yeah. So how is that used? I mean, is that used in terms of patient communication, or how does that fit into the process? Yeah,
it's certainly people looking at screens, whether they be the prime scan itself, or we have big screens in the surgeries as well, and actually be able to physically see what's going on in their mouth. It's always been helpful. Intraoral cameras have been around a long time, but the fact that it's digitized, they find that quite impressive, and it's useful for us. Of course, we don't have garden sheds full of study models these days, which is a great relief. So that's very, very helpful. And I think we haven't mentioned our patients yet very much, and actually it's all about them, and
Absolutely.
It's massive the effect that the patients perceive and the reality for them looking at the hardware and what comes out of this and the software. They're blown away by it. They're really impressed with it, and one thing that surprised me, it doesn't now, is we actually have patients actively seeking our practice because we're digital. Because we always like to know, why have you come to see us? And of course, traditionally, word of mouth is very big. Social media is big, but also people who've looked at our website and looked at other social media things we do or speak to patients of ours, they say, well, we came here because this digital dentistry that you're doing looks really impressive. And that's relatively new, but I think that's becoming more and more significant. And certainly if you look as the generations pass on, our younger generations, they've grown up with technology. I think they're going to expect this technology to be in your practice, and if you've not got it, why haven't you got it? And maybe I'll go and find somewhere else that has.
Yeah, I think that's a brilliant insight, and obviously that sort of touches upon the points of patients looking towards new technology, and I think the patient communication thing. I don't think we can underestimate that in terms of the screen and being able to see what the patient's what's happening inside their mouth. But the other thing that I'm really keen to ask you about is patient comfort as well. I won't sort of impart my own opinion, having recently had an orthodontic retainer and a manual impression taken for that. But I'd like to ask you for your insight from patient feedback. What's the difference between having a manual analog impression and a digital impression for the patient?
Right, for the patient, it's just a lot more comfortable. I've treated a lot of my patients for quite some time, and to have a patient who I've treated for over 10 years say, I never used to like those impressions. Oh, they were awful. This is so much better. And I thought I knew you. And that's great. And certainly, so from their perspective, obviously it's less invasive. It's more comfortable. There's no retching. The Prime Scan has a bigger camera than the old Omnicam. And actually that's a benefit because we're getting more in our picture and our field of view. Yeah. So that, the scan is so quick. And of course, from my perspective and the laboratory's perspective, it's incredibly accurate. The opportunity for error doing things in what we might call the analog way is significant. You take an impression, you've got a patient who might be gagging, there's blood, there's saliva, there's different temperatures in the surgery. You then might post it then may go into a van or a car. There's lots of opportunities for things to go wrong and inaccuracies. And doing it this way, great for the patient, very accurate for us, whether or not we're manufacturing or sending the impressions, the scans to the laboratory.
Yeah, I think that's a fantastic point that I'm just going to pick up on, really. I think I'd like to just ask you to maybe delve a little deeper into the effect of a previous analog workflow where there is something wrong with the impression, and maybe at some stage there has to be a remake, or it's got to go backwards and forwards between the lab. Yeah. With this workflow, that's completely different, isn't it?
Yes, in terms of remakes, I'm not saying it never happens, but the most common occasion that we would remake, say, a crown is a single upper central, and you haven't quite got the shade right. Now, in the old days, doing it analog, as we say, it would be, put the temporary back on. Oh no, I've drilled it off, I'll have to make another one. Never happens. And then they come back a week or two later and have the new crown, which hopefully is the right shade. And that was fairly rare, but it did happen. That if we get the shade wrong or the effects that we're putting on wrong these days, I can say to my patient, have you got half an hour spare? And they usually say, yeah, I can wait another half an hour, by which time we then make the crown and it's perfect and we fit it. And that's really powerful. It saves me time and hassle and money, saves everybody time, but most importantly, the patient still gets their thing done in one visit, whatever it is, and that's brilliant. You can't do that any other way.
Yeah. And I suppose just to build on again on the patient, as I said, we'd sort of finish up talking about the patient really, and the workflows that it enables the treatments that it enables for the patient. How would you say the practice has been affected in terms of the workflow opportunities, but also the patient uptake of treatment as well? How would you say that's been affected?
We've always had a good uptake of treatment for whatever reason. Certainly the fact that it is easier, more comfortable, is only going to help, and it does help. And you know, time is precious for everybody, and that we have, and quite regularly we'll have a patient that, you know, works abroad or works or lives a distance away, and the fact that we can do something for them in one visit, that's massive, and you know, they really appreciate that. So yeah, that's from the patient perspective. Just as I said, time's precious. It works really well for them from that point of view.
Yeah, so there's a convenience aspect to this as well, really, isn't there?
Yes, there is. And are we doing more workflows? I mean, we pretty much did most things anyway.
Okay.
But we're doing a lot more aligners now, and again, digital aligners. There are people talking about aligners and the digital aspect of it over these couple of days, and it's such an easy workflow. And again, we're getting these really accurate impressions, and you know, patients really appreciate having digital impressions, and perhaps only one set from start to finish. Yeah. You know, and again, that's far more acceptable for them.
Yeah. Yeah, absolutely. And the other thing that I know we've talked about previously is implant workflows as well. And for anybody watching, I've recently been working with Simon on developing a course of utilising CEREC within implant workflows. Would you like to say a few words just on how it's impacted on implant workflows specifically? Yeah,
again, it just makes life easier for everybody. You know, we start off perhaps with an intraoral scan. Quite often we would, because we're making our surgical guides for single units. We'll mill the guides, so we'll take an intraoral scan, we'll do a CBCT scan, we'll merge those, I'll design the guide, and it will be milled in one of our mills in a matter of 45 minutes. So that's very efficient, very accurate, but also as a business owner, I might have been paying £300 or £400 for surgical guides. Perhaps £45 it'll cost me, so there are significant savings there. And also there's nothing quite like the person putting the implant in actually designing the surgical guide. And then again, that makes the surgery easier, and then when it comes to restoring the fixture or fixtures, we're manufacturing the crowns ourselves with, you know, tie-base abutments, and again, single visit for that. You know, with the impressions, literally 15 minutes, we put the healing abutments back in, and I say, well, why don't you go and have a cappuccino? There are plenty of places near the practice they can do that. And so they go and have a cappuccino, and 45 minutes to an hour later, they come back and we fit their crown or crowns. And that really efficient workflow, very, very accurate. And again, I think with doing implants digitally, but also just doing everything digitally, it really improves things like your crown preps. Because rather than us sending off an impression of, that looks all right, yeah, we'll send that. I mean, we're obviously far more, you know, careful of looking at our impressions. But rather than doing that, you actually see your preps and you see your emergence profiles on a big screen in front of you. And so your standards improve, which again is quite interesting. You get better at what you're doing because you're seeing it every time you do it. And you look at it and you think, yeah, that could be a bit better. So you might go back and do something to your prep, and that's very useful. And again, just looking at the costs, the overheads doing crowns or implant retained crowns digitally, you save hundreds of pounds in material costs.
Wow. Hundreds of pounds.
Now that doesn't mean that, you know, we don't use our laboratories, because we do. We do everything digitally that we can. So if we're making, for example, partial dentures, we'll take a digital impression, it'll be sent to the laboratory, and depending on what it is, it may come straight back finished. That's if it's saying, say we're doing an acrylic denture for an immediate denture for an implant case, and that's fantastic. And they're so accurate, and they look really good, and they fit beautifully. And again, it's less time in surgery, so we're more efficient, less time for the patient, less invasive for the patient, and it all just works. and the laboratory are happy because they're getting really good impressions.
Well, that, again, you lead me on nicely to my next question, really. I was going to ask you specifically, how has it affected your relationship with your laboratory? Because I think from speaking to you previously, this is perhaps one of the misconceptions about CEREC, really. So, yeah, could you elaborate on that?
Well, I think I said earlier, in the beginning, try not to sound too biblical, in the beginning, you think you can do everything, and you clearly can't. But you can do an awful lot, and you can do it better than you did. But there are clearly signs, I mean, aesthetic cases. I used to manufacture implant bridges, and they were fine, but hard work. So I don't do that anymore, and it's a learning journey. Yeah. And so, for example, if I'm doing implant bridges, I'll just send off a digital impression and we get a beautiful bridge back that fits perfectly, the occlusion's spot on, looks great. And yeah, so the relationship with your laboratory, it just improves because the quality of the impressions, as I said just before, is so good. The information they're getting is so good, and it's undamaged. As I said, the potential for inaccuracies has gone, unless you have a very shaky hand, which of course the scanner would sort that out anyway, but it's really, really efficient, it's really accurate, and as I say, the lab, they really like it.
So I think that's a point probably worth picking up on for the audience. In terms of wet-fingered dentistry, you find that this is so accurate that actually you're getting better fits with this than taking a conventional analog impression.
Oh, undoubtedly. I mean, we won't get too scientific perhaps in this sort of forum, but the evidence out there now for the accuracy of intraoral scanners, you can't argue with it. You know, you will have, I'll stick my head above the parapet and call them the Flat Earth Society, but we can always cut that out. But there are people that will talk about gold standard impressions, and the reality is gold standard impressions are done on a bench top in a laboratory somewhere. They're not done on human beings with gag reflexes, with saliva, with blood, with feelings. You know, it's just not the same. And so when you actually look at the accuracy of impressions done on human beings and intraoral scan impressions, particularly with the newer scanners and the better software, they're incredibly accurate. And as I said, there's all the other advantages as well.
Yeah, no, absolutely. I think it's probably a point worth picking up on, knowing how far that you can go with CEREC, and that is a learning process, isn't it? Yeah. I mean, we've got guys, we've got another session coming up where we're going to be joined by another one of our CEREC KOLs, Lino Adolf, and we're going to have a discussion in that session about how far you can take CEREC. So it's definitely worth tuning in for that. But again, would you like to just say a few words on that learning process?
Yeah, as I said, it is a process. It's an overused expression. It's a journey, but it's a good one, you know. And certainly, the more you do, I think I'd like to think I'm doing my job a lot better. I think my patients are getting better things, but I'm also recognising there are some things I absolutely shouldn't be doing because we've got fantastic technicians out there who can do the most amazing work. And so long as I give them what they need, and of course we can communicate, you know, there'll be digital photographs going backwards and forwards, hey, we'll FaceTime, you know, whatever we need to do, the communication's way better. And yeah, as I said, you learn fairly quickly when you need your laboratory. And certainly larger aesthetic cases, if you're doing cutback veneers, whatever, you can't do that with a CEREC. I mean, I have seen people do that, but I wouldn't be doing that. I would be sending it off to my laboratory. I could make some extremely good temporaries, you know, lots of different materials we can use now, and the temporaries are fantastic and they fit beautifully, but then I know what I'm going to get back from the lab is going to be absolutely top-notch.
Yeah, yeah. And still within the remit of what you're able to achieve with CEREC, coming back to the topic of conversation really, the profitability is still by way and above that of the investment that you initially made.
I was surprised, and I'm not surprised very often. And to be honest, these days, I've been around too long possibly, but I was genuinely surprised at the difference it made in my bottom line. Okay. You know, we get sort of questions from the accountant saying, oh, your materials costs have gone up a lot. And said, yes, we're using lots of blocks, but look at the laboratory fees. And then, of course, the bottom line, literally year on year. I'm sure it'll stop at some point, but so far it hasn't. And the digital is a massive part of that. You know, not just pound notes in terms of what patients pay us and what we pay or don't pay to people. As I said, it's just the overall efficiency. And it's a much, much nicer way of working for everybody.
Yeah, absolutely. Just in terms of that, so the bottom line, as you put it, in terms of the CEREC system itself, is it easily scalable for a practice?
Yeah, that's a good question. I mean, we started off with 2 scanners and 1 mill and a Speedfire furnace and the CBCT. And then very quickly we bought another scanner and another mill. We now have 3 mills. We have a scanner in every surgery. As you know, we're expanding, so you'll be pleased to know we'll be buying some more scanners and possibly another mill. And it is easy to scale. And the thing I would say to people that are looking at digital, make sure that all of your bits of equipment speak to each other. Because what you can find is if you buy a CBCT made by somebody else, there'd be a very good piece of kit, but you just want to make sure that everything works and you don't have to worry about compatibility and things. So as you know, everything I've got is Dentsply Sirona. It works really, really well. Good software and good backup as well. So scalable, yeah, you know, you'll find out very quickly, and as we did, that we actually needed more of it because it didn't make us do more crowns and bridges. We were already busy from that point of view. But as I said, it has led to more and more patients coming to the practice. I mean, obviously we're not post-COVID, but we're post-lockdown wherever we're at. And as I said at the beginning, we're really, really busy, but we're seeing 3 times the new patients we were getting on a monthly basis 18 months ago.
Wow.
Now, some of it will be post-pandemic. Some of our colleagues are struggling, so we're getting patients for that reason. But as I say, some of it is the draw of the digital, definitely, because patients are saying, that's why we've come to see you.
Absolutely. And so on that front, is it something that you market directly to patients?
It's on our website.
It is.
There's a lot of stuff on the website about it because we feel that's our, what are you marketing people call it? USP, is it? Okay. Something like that. So at the moment, we are unusual, and where we are, there aren't many people doing digital dentistry now. As you know, I'm a great advocate of that. Has to change. You know, as a profession, particularly the teachers in our profession, the undergraduates, they need to be learning about this. As I said, they are that generation. They'll be wanting to do it this way. But yeah, so do we specifically market it? Certainly anyone that looks at our website will know this is how we do it. Yeah. There's lots of videos on there about me jabbering on about how marvellous it is, and some interesting pictures as well.
Fantastic. That's brilliant. Well, I think that's given us a really fantastic insight, so thank you, Simon. It's clear that patients like it and that it works very, very favourably for the business side of a practice as well. Now, Simon and I did allude to how far you can take CEREC. I'm pleased to say, as I mentioned earlier on, that we're going to be joined by another one of our CEREC trainers, Lena Adolf, in another roundtable session. And so I would absolutely urge you to join us for that session, where we're essentially going to be talking about how far you can take CEREC workflows, maybe particularly with anterior aesthetics. So I'll look forward to that session. But for now, Simon, thank you very much indeed. It's been a great pleasure.
Thank you.
Thank you.